started. Good afternoon, everyone. Today is Tuesday, time flies, April the 14th. I'm Dr. Valerie Cush, Chair of the Montgomery County Board of Commissioners. I'm here with Vice Chair Ken Lawrence, Commissioner Joe Gale, Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Wong, our Regional EMS Director. Since our April 13th press briefing, we have had 99 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 2,123. 2,123. These positive individuals are from 30 municipalities, which keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 11 years old to 97 years old. And as always, you can check our county map at montcopa.org/COVID-19 for an update of the municipalities where these individuals are located. The age brackets today, we have 3 people between the ages of 10 and 19, 6 between 20 and 29, 6 between 30 and 39, 10 between 40 and 49, 16 between 50 and 59, 16 between 60 and 69, 12 between 70 and 79, 20 between 80 and 89, and 10 between 90 and 99. There are 64 females and 35 males. 22 are hospitalized, 15 are in isolation in their residence, and 62 are unknown. I'm also saddened to confirm that 18 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 109 deaths. 9 of these individuals were hospitalized, 1 passed away at their residence, and 2 are unknown. These individuals ranged in age from 69 years old to 97 years old. The racial breakdown among this group is 8 were Asian, 2 Asian Indian, 1 Asian Korean, 15 African American or Black, 42 Caucasian, and 41 unknown. The gender in total for all of our deaths, of the 109 deaths, 48 female and 61 male. Our most recent data on our hospitals is that every hospital in Montgomery County does have open beds, which continues to be wonderful news. We do have our surge capacity up and ready to go if needed, but thankfully for now we don't need it, and that is thanks to your good work at staying home. I want to announce that today President Judge Del Ricci announced the extension of the declaration of judicial emergency in the 38th Judicial District until May 31st, 2020. Today's update on our long-term care facilities. As you know, we're now tracking the 75 Pennsylvania Department of Health licensed long-term care facilities in Montgomery County and a number of other congregate care locations. These are settings which provide overnight services. The total list is approximately 620 locations. We now have from these sites 73 facilities that are reporting positive cases of COVID-19. In total, there are 364 cases involving residents and 223 cases involving staff, for a total of 587. There are 45 facilities with 1 to 5 cases, 10 facilities with 6 to 10, 5 facilities with 11 to 15, 4 facilities with 16 to 20, 2 facilities with 21 to 25, 4 facilities with 26 to 30, 1 facility with 36 to 40 cases, 1 facility with 41 to 45, and 1 facility with 51 to 55 cases. To date, There have been 67 deaths among individuals that resided at long-term care facilities. This is 61% of our total deaths. Outreach continues to be done to these facilities. We work to provide guidance based on CDC and Pennsylvania Department of Health guidelines. Pennsylvania Department of Health has also engaged ECRI to assist with this work, and we have communicated to ECRI some of our hardest and highest priority locations in terms of long-term care facilities. We continue to be in daily, in some cases, and near daily, in all cases, communication with these locations. We are assisting them with their requests for personal protective equipment. We are pleased to announce the collaborative partnership with Real-Time Medical Systems Monitoring. Letters have gone out today to the facilities that have electronic medical records, asking them to volunteer to participate in this opportunity to share anonymous patient data, including numbers of patients with fever or cough, with our Office of Public Health. The goal being that we can assist these facilities with trend tracking and early response should there be individuals that we suspect could be positive for COVID-19. And again, we want to thank Real-Time Medical as they are donating this service to Montgomery County. Today's update on the community-based testing site. So as you know, as of April the 9th, we had tested 4,844 individuals. We now have, excuse me, 93% of those results back, and we are running 16% positive overall for this test site. As we continue to look back and continue to get more data, I can confirm that we did seem to peak on Sunday the 5th and Monday the 6th of April. Both days we were at 24% of the individuals tested coming back as positive. We have been on a downward course since then. I do want to be clear that this just applies to the individuals who were tested at our community-based testing site. This does not necessarily apply to other communities, such as residents of long-term care facilities. As I have been mentioning, we are relocating our drive-through site to the campus of Montgomery County Community College in Whitpain Township. The new site will open on Thursday, April the 16th at 10 a.m. Thursday, April the 16th at 10 a.m. We did lose a day yesterday in terms of setup because of the extreme weather, so we will be opening on Thursday. The appointments for Thursday will open at 8 a.m. Thursday morning. Appointments can be made at montcopa.org/COVID-19 by clicking on the green County Testing Information button, or if you don't have good internet or an email, by calling 610-631-3000. I do want to highlight two changes. The site will now use self-swabs. These are the kits that we have been sent from the Department of Health and Human Services. So individuals will receive a swab in a sealed package. The person being tested will open the swab, place it into one nostril about halfway up, and hold it there for 15 seconds. You will then take the same swab and repeat that in the other nostril again for about 15 seconds. The person being tested will then place the swab into a tube for transport. A video showing this very simple process is now up at montcopa.org/COVID-19. Click on the County Testing Information button, and then on that drop-down menu, you can click on What to Expect. And there will be a video that shows this process in great detail. It's really very simple. It's nothing to be worried about. The swab is small. It only has to go just a short distance up into your nose. So we hope that this people will find this a very, very easy procedure. The second thing that I want to highlight, or the second change I want to highlight, is that if all of the slots for a given day are filled when you go online or make a phone call to make an appointment, the individual who is wishing to make an appointment will be offered the option to go on the waiting list for that day. So you don't have to go on the waiting list. You can try again another day, but if you are willing to be on the waiting list, You will now have that option because we do have cancellations every single day. And if there is a cancellation, you will be contacted, and hopefully then we would be able to accommodate you that day. We've created this waiting list with the hopes that we will be able to utilize every single one of the 250 tests per day that are guaranteed to us here in Montgomery County. So we want to make good use of every one of those tests. And finally, we continue to get lots of questions about opening up. I so understand that everyone wants to get back to work, wants to get back to seeing their family and their friends, but we are not there yet. Although we've gotten some relatively good news in the scheme of things, that we seem to have peaked last week, as you heard today, we still had 99 new cases here in Montgomery County. It is not time to take any risks or chances. We're just not there yet. And we continue to learn from the countries that have come before us. And if you have followed the news at all in the last day or two, we are seeing that in Japan, in Hong Kong, and in China, the resurgence of COVID-19 infections, and in Japan and Hong Kong in particular, the reinstitution of strict mitigation measures in some places where they have been lifted. So I think the last thing that any of us want to do is lift these restrictions too early and then find ourselves 2 months from now right back in this situation where we have to close everything down again. The best way to get through this is to stay closed for now, wait until the number of cases falls to 0 or near 0. Hopefully by then have in place widespread testing and easier ways to do contact tracing. And then we can start to open things back up in a data-driven, evidence-based way. But we're not there yet. And so I just want to encourage everybody to continue to do what you have been doing. Your personal sacrifice has ensured that our hospitals still have beds, that our first responders are still able to respond and meet all the needs in the county, whether you're having a heart attack or you need to go to the hospital for COVID-19, there is someone who can safely transport you to the hospital, and there will be a bed for you on the other end of that ride to the hospital. That has been our number one goal. We continue to have our grocery stores open. We continue to have our pharmacies open. These are the critical things that we all need for our survival, and we've been able to reach these goals because you have cooperated and you have stayed home. So I know, as anxious as we all are to get this thing over with, we are not there yet. So please, please continue to do what you've been doing. And with that, I will turn over to Commissioner Joe Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. We know that many people and businesses are feeling the harsh financial impact of this crisis. For the past few weeks, I've been providing information about unemployment compensation, business loans, and property tax deadline extensions that are designed to help relieve these pressures. Today, I want to make you aware of another option that may be available if your emergency savings are running low. The Coronavirus Aid Relief Economic Security Act, or the CARES Act, passed by the federal government, temporarily loosens the rules on hardship withdrawals from your retirement accounts such as 401ks and IRAs. Typically, if you are under the age of 59 and a half years old, you will face a 10% penalty when you withdraw money from your 401k. The CARES Act gives people affected by the crisis access of up to $100,000 of their retirement savings without the usual 10% penalty. The law also doubles the amount that the 401k participants can take in the form of a loan from their accounts in the next 6 months. The maximum loan amount is $100,000. Borrowing against your 401k means you are borrowing from yourself. Unlike borrowing from a bank, the interest you pay to yourself. The amount you borrowed is no longer invested in the market, so rather than getting investment gains, your gain is the interest you pay back to yourself. Under ideal circumstances, you would not have to touch these savings, but if your personal emergency savings are running low, the Federal CARES Act has created these options for those who need access money from their retirement funds. The new rules apply to a whole range of people, including those who have lost a job because of the pandemic, those suffering from COVID-19, or who have a spouse with the virus. If possible, we recommend consulting with a financial advisor to determine whether it makes sense for you to use some of your retirement savings to ride out the COVID-19 pandemic, or if there are other options that might be available to you. I will continue to provide updates on options and efforts that may help you get through this difficult time. Thank you, and we'll turn it back to Commissioner Arkoch.
All right, happy to take questions.
The changes in the testing, is that a new kit? Is that an evolution of the testing, or is it just?
So it's a new kit, and it's the kits that we are being sent by the Federal Department of Health and Human Services. And by using a self-swabbing technique, it reduces the amount of personal protective equipment that is needed by the individuals that are working at the site. So, and this is one of the many efforts going on nationwide to conserve the amount of personal protective equipment that is in use. So my understanding is they're converting all the testing sites over to the self-swab approach. And it's really very easy. I know it sounds kind of maybe not that attractive to people, but it's really very easy.
Well, it sounds a lot.
Just takes 30 seconds or so.
It sounds a lot easier on the person too, rather than scratching.
I actually think it will be easier on the person because it goes just into the front part of the nostril. The tests that are administered by others, really get to either the back of the throat or fairly high up in the nostril. So I think this will actually be more comfortable.
Two questions on the testing front. What are you going to be doing to increase the number of people who can be tested here?
Well, the question is, what are we going to be doing to increase the number of people tested? Right now, we had to fight an incredibly hard fight last week that involved our entire congressional delegation to get the 250 tests that we were about to lose. So I am really happy to have that. There are no other options that we are aware of right now. We are hoping to get one of the real-time tests, one of the machines here into the county. We're working with the Pennsylvania Department of Health to get one of those machines. Once we get that machine, we will use that to go into some communities that may not have been able to easily access our drive-through testing site. But those machines, and we've been told we're only going to get one, can test at most 5 people an hour, but realistically probably 4. So it's great, it's better than nothing, but we need many, many, many more of those machines. And hopefully over time they will become more available and we will certainly get them as quickly as we can.
And likewise, what are you going to do to handle that tracking that you were talking about? I think it's called contact tracking for people who have tested positive. How are you going to go about doing that process?
Well, I want to be clear that that's not something we're going to start right now. We were doing that in the early days of the first couple weeks when people started to turn positive here. Contact tracing is traditionally done as a very labor-intensive process. It requires someone in our Office of Public Health to call the person on the phone who's tested positive and go through a pretty extensive interview with them, asking them everything they can remember from 2 days before they started having symptoms up until that moment, every person they saw, every place they went. And then that same person then tries to track down all of those people. It's incredibly labor intensive. Once we start looking at opening up, in the perfect world, we would be able to do much wider testing. We'd be able to test anybody that thought they'd been exposed, maybe had a household contact that was exposed, anyone that was having any kind of symptoms, or anyone that was part of a critical workforce, like a hospital worker, a paramedic, police officer, those types of folks that had been on the front line, grocery store workers, pharmacy workers, just to make sure they were negative. There's another set of testing coming. I think more of these are going to be FDA approved soon that will be able to test for antibodies. We don't actually know what the antibodies mean. Just because you have an antibody, it probably means it does mean that you were exposed to COVID-19 and had it. But what we don't know is if these antibodies give you immunity, and if they do give you immunity, for how long. There's been some concerning data coming out of some of the Asian countries that people that had COVID-19, that had thought that they were clear of the virus, are turning up positive again. So these are all questions. I mean, remember, this is new since January. These are all questions that we're hoping to get answered to some degree before we start telling people, you know, to head out and go about their business. So that's part of why we say it's a ways away. So once we get many more people tested, there are different ways to try to figure out how to do better contact tracing. Some countries are using electronic means, and there's different ways of doing that through cell phone apps that people download and voluntarily allow themselves to be tracked. Other countries are doing much more sort of treading on people's personal liberty by demanding that. So I'm not suggesting one or the other, but my point is that we will need to do something that is less labor intensive than what we were doing before, because there are literally not enough hours in the day to do the kind of extensive human-to-human contact tracing that we did in the first 2 weeks of this outbreak.
Who do you think is best served?
What do we like?
I'm sorry.
Go ahead.
And so with that, you know, we're talking about testing and whatnot. You said you felt like the numbers needed to get closer to 0 before we can open businesses?
Yes. So the question is, I said the numbers needed to get closer to 0 before we can start opening businesses. And I say that because if you remember how the course of this disease, anyone who turns positive could have infected their contacts for at least 2 days before they had symptoms, and then for any period until they've gone into isolation once they had symptoms. And we know that it takes 14 days for some people to start to have symptoms themselves. And we've seen this. We've had people that were tested on 14 days after they were exposed and that they started to have symptoms. And so it can take the full 14 days. And so from the day that there's the last case that we know about, right, it's going to have to be at least 14 days before anyone that last person contacted, before we know that that person isn't positive.
So this seems to be very different from what we're hearing from like the president and other people who are really pushing to, you know, potentially May 1st, early May, maybe mid-May. So are you saying those numbers are too fast? Are you saying maybe some businesses would be able to open then? Or you're just saying you just don't think that's accurate?
I'm telling you as a physician, what is the safest thing to do from the health of the public, for the health of the public. That if we open up too quickly, without waiting till we get down to 0, and then a period after we're at 0, I think we are almost certainly going to find ourselves in the position that Japan, for instance, is today. They lifted restrictions after a relatively short time period. I think it was only 3 or 4 weeks in some of their particular communities. And now they're back to double-digit cases, and they're putting those restrictions back on. So I go with the data. I'm trained to follow the data and the science, and the data and the science says we have to wait till we're down to 0, and then we have to wait at least 2 more weeks.
Thank you.
Ma'am?
Yes, Mr. Millward.
If there is an instruction from a higher level of government, is there any recourse for the county to say, we're not ready yet, we're not reopening?
The question was if there is instruction from a higher level of government to reopen, so to speak, do we have recourse as a county? I would have to ask my solicitor to review our emergency public health declaration. I don't have an answer for you on that today, but I can certainly get one.
If you could refresh me, you mentioned ECRI and how that works with the long-term care facilities.
So ECRI, I don't know very much about it, but ECRI is an organization. They actually are based in Montgomery County, I believe, but I'm not personally familiar with them. They were engaged by the Pennsylvania Department of Health to assist these long-term care facilities, which are licensed by the Pennsylvania Department of Health, to assist them through this outbreak. I'm not exactly sure what they're doing, but I think they're offering guidance on how to manage an outbreak within a long-term care facility.
And is there a level of education or something to try to prevent it getting into these communities? Is there, what kind of efforts are done? Obviously the visitation's not happening, but what about employees and staffing and those kind of things for those people not to bring it in?
So the question is, what kind of education is being done in the long-term care facilities? The long-term care facilities are not under the county's purview directly. As I said, they're under the state DOH's purview. I will tell you that back in February, early February, the Hospital Association of Pennsylvania, which many of them are members of, asked our Office of Public Health to go in and do some educational outreach, which we did in the ones that invited us in. But since then, I don't know, you really have to talk to HAP, and you really need to talk about the Pennsylvania Department of Health about what they've been doing. It's been in recent days that we have started checking in with them, and we did that for a couple of reasons. It started to become clear that there were more and more ambulances being called to long-term care facilities, so we wanted to have a sense of what the volume might be for our first responders and our hospitals. So we began touching base with them on a daily basis, and of course, every time we do reach out, we ask them if there's any assistance we can provide around education, around the CDC and PADOH guidelines in managing this pandemic. We also became the point person for them for their PPE. So the county Department of Health and Human Services received an allocation of personal protective equipment specifically for long-term care facilities from the Pennsylvania Department of Health. So they asked us to help distribute that PPE on behalf of the PADOH. And so we've also been assisting with that.
What do you think the new normal will eventually look like? Again, I know you're saying it's going to be weeks off, but are we talking people are going to be walking around with masks, washing their hands? What do you think the new normal will eventually be?
The question is, what's the new normal going to eventually be? Well, I wouldn't call it the new normal. I think that for a temporary period of time, we will need to behave differently. And that temporary period of time could be as long as a year, year and a half, potentially shorter than that. It's all going to depend on two things. One, is a treatment found that actually treats COVID-19 with a high degree of success, so that getting ill, particularly if you're in one of the more vulnerable groups, isn't likely to result in death. You know, we don't have treatments that have been proven yet to be highly effective. So that could be a game changer. And then of course, a vaccination becoming available. So those things could make a big difference in letting us get back to what 6 weeks ago were our regular lives. But between now and then, we're going to have to be different. I think social distancing needs to be part of our daily routine for a while. And things like the ability to do effectively mass testing, you know, being able to test large percentages of the population, both for presence of virus and for the presence of antibodies, will also help tremendously to making people feel comfortable that it's okay to go back to work, it's okay to do other things. So this is going to be with us for a while, but this is not going to be forever. And I would continue to remind everybody listening that the way we make that period as short as possible is to continue the social distancing that we're doing now. This county has been tremendously effective in that, and we just need to keep at it until some of these other things are in place to protect the public's health. Anything from outside? Yeah.
Yes, the first question is from Kevin Tierney from More Than the Curve. Of the construction companies that have been granted permission to operate in Montgomery County with a waiver, have any construction workers been tested positive for COVID-19? And is there any way to monitor cases for construction workers in the county?
So the question is, just make sure everyone can hear it, of the construction companies that have received waivers to continue to work, have any construction workers tested positive for COVID-19, and is there a way to monitor them or that? I can't answer that question. We do not get the employment data of individuals who have been tested for COVID-19. So I have no way, there's no mechanism in place to answer that question, unfortunately.
The next question is from Vinny Vella from the Philadelphia Inquirer. And I believe you did touch on this earlier, but if you could, I guess, just look at the statistics one more time. So his question was, in previous briefings, you've given us the total number of cases among residents and staff members across the county's nursing home facilities. Can you tell us the total number of patients at those facilities who have died from COVID-19 since the pandemic began?
So the question is the number of individuals who were at a long-term care facility that died from COVID-19. The number that I have today is 67.
The next question is from Stephanie Yin from WHYY. Has COVID-19 spread to more workers at the Limerick Generating Station?
So the question is about, has COVID-19 spread to more workers at the Limerick Generating Station? So I did not get a chance to check the daily report today. I think that question would best be addressed to Exelon. The numbers over the last couple of days were somewhat stable. I did express my concern to Exelon that they had symptomatic individuals who had not been tested and urged them to get those individuals tested, but I don't know if they have been tested and what those test results are if they have been tested. So again, that is best to go back to Exelon on that.
The final question is another one from Stephanie Yin from WHYY. A science paper published by Harvard researchers suggests that we will continue to see winter outbreaks of the coronavirus, and that to avoid exceeding care capacities, some level of social distancing may be necessary into 2022. Is that something that Montgomery County officials have seen and are discussing?
So the question is about a paper published in Science from some Harvard researchers about possibly needing to continue social distancing into 2022. Number one, I have not read that paper, but I will certainly take a look at it. I think that scenario would apply if there's no treatment and no vaccination, then that would be a very, very different conversation. But hopefully, long before 2022, we will have a treatment that's effective for COVID-19, and more importantly, we'll have an effective vaccine. Is that it?
That's it.
Okay.
Thank you.
All right, thanks everybody.